Welcome again to everybody. We are getting the tail end of, I guess it was 3 or 4 presentations to be taken care of for this week. This is actually group 9 though. They're going to be reporting on HIPAA themselves. So I will go ahead and turn the time on over to them and they'll go ahead and take it away.
Hi guys. Alrighty, so we're going to start off with the history and introduction of HIPAA, why it was signed into law, and we're going to go on over to the next slide, please. Alrighty, so it was signed into law in August of 1996. It's called the Health Insurance Portability Accountability Act, and the main idea was just to improve the portability and accountability of health insurance coverage for employees between jobs. It was also to combat fraud and the abuse of health insurance and healthcare delivery. Included passages about medical savings accounts and providing coverage for employees with pre-existing medical conditions. And it simplifies the administration of health insurance. Next slide, please. Procedures for simplifying the administration of health insurance was there to help encourage the healthcare industry to computerize patient medical records. They then also spawned, later we'll talk about the Privacy and Security Rules Act, which helped protect health information, which you'll notice that in a lot of stuff they'll ask about confidentiality and who they can share your information with, and that sort of a thing. I'm just saying what I know. Okay. Next slide. Can you hear me? The HIPAA security rule laid out 3 security safeguards. It was for administrative, physical, and technical. So the administrative was to create policies and procedures designed to clearly show how the entity would comply with the act. So just how everyone carrying out the act should actually, like how they should carry it out. And then the physical was to control the access that like the physical access of records, and then the technical was to help support and protect communications when transmitted electronically over open networks. And then the introduction to the enforcement rule gave the Department of Health and Human Resources the power to investigate complaints against, like if someone felt like their privacy was compromised through a doctor's office, then they would have the power to sue. And then gave the power to bring criminal charges against people that failed to comply with HIPAA. Next slide. The intent was to make healthcare reform easier and more accessible for everyone while maintaining the privacy for every individual involved. And it's been successful. In many cases have been helped because of HIPAA. And that's it for my stuff. Somebody next?
I'm here. Just trying to figure out the mute. Okay. Title I, also known as COBRA. COBRA sets rules designed to protect health insurance customers. One piece protects customers from being charged differently than their fellow employees. You want to go to the next slide there, Wyatt? You there?
I moved it. Do you want me to keep going?
Yes, please.
All the way through?
Yeah, go ahead and click through these one at a time.
What are you seeing there, Troy? I've got requires group health insurance.
Next slide.
Sets rules that define.
I'm still only watching Title I. I don't know what's going on your end, I guess.
Let's see. Is everyone else seeing Garrett and Dara?
I'm seeing sets rules that define pre-existing conditions.
All right.
I'm seeing everything here.
All right. Something must have changed on my end. Sorry about that. All right.
That's fine.
So One Piece protects consumers from being charged differently than their fellow employees in a group plan or from being denied for pre-existing conditions. Another limits the length of time that a pre-existing condition may be excluded from coverage and defines what can be considered pre-existing. When an employee leaves one job with a group insurance plan and starts another job with any other group plan within 63 days, their coverage cannot be delayed, as is often the practice coming into a new plan from being uninsured or previously having been insured. They may have had the opportunity to deny you coverage for a period of time as one way of avoiding paying for pre-existing conditions. But this COBRA Act eliminates those kinds of concerns for people who are switching jobs. Okay, we should be on portability. It says this one protects people who lose their jobs by allowing them to keep their insurance as long as they can pay the full premium. So I guess that was before portability, sorry. Portability. The portability portions of HIPAA are designed to make consumer information easily transfer between the payers and providers. Specific forms have been standardized and made available electronically. Not all physicians are required to comply. However, every provider working with government healthcare, Medicaid, and Medicare systems must comply and use the online forms. Mr. Garrett.
All right. So I'm just taking up the last two kind of portions of this, and it talks about, first of all, how does HIPAA protect my privacy and security? We're kind of looking at how does HIPAA apply to us, and how can it protect us and provide privacy to us? Next slide, please. So kind of going back to what Dara said about the privacy rule, the information that we have in our, excuse me, hold on. I lost my notes here. Okay, there we go. So there's lots of different types of information. Obviously, it's kind of, I'm just have it right here: printed information, spoken, electronic means. The privacy rule, for the first time, creates that national standard that protects all of the individual medical records, protects all their health information, and it gives them more control over their health information. It also is going to set boundaries on the use of those records. I work in a medical clinic. I work actually in a podiatrist's office, and this is something that I deal with every single day. I'm a receptionist, so I'm checking people in and out. I'm setting up appointments, things like that. Protecting people's printed information is actually a lot harder than it seems, and it takes a lot more steps. To continue on with this, kind of going with the rest of it here, we live in the social media age, and there's actually a lot of changes that will be made or going to be made just because of the age that we live in. And there's also social issues like people with issues like HIV and other things that where they would want their information to be kept safe, not necessarily secret, but kept out from the eyes and ears of those who don't want to see that they have that specific issue that they deal with in their lives. Also, with the lesbian, gay, bi, and trans LGBT community, they have not necessarily different rights or anything like that, but it's been a big push lately to make sure that their information is kept secure and that they are treated just like any other patient. If we can go to the next slide, please. All right. So as I went through this, as I was thinking about how to present this or what I would want to hear, I just kind of thought about what are my rights. Patients have rights to see and get copies of their medical records. And that, like I said before, that can be kind of difficult to do at times. For example, a person can be 100 miles away and be seeing a doctor the next day and say, hey, I need all my records sent over to this other doctor. And we say, well, we need that in writing, and we need to have you actually request it so that we can send it over. That's very, very important, and it can make people angry, but it's that important that that there's a bunch of rules set in place to make sure that happens and happens correctly. Second part, patients always have the right to ask. So even though you might not be able to see your full record, you always have the right to obtain it, or at least ask to obtain it. What I mean by you may not be able to have the full record. What I mean by that is it might not be all the x-rays or all the different information about how the appointment went down, but it will at least give you all the pertinent information to what happened that day when you saw your doctor. One thing I didn't know, which I thought was interesting, which I haven't seen yet necessarily, but is that amendments can be made if you disagree with your doctor. I don't think that applies to if your doctor gives you a certain diagnosis or something like that. You can't just say, well, I disagree. Can you change that? Can you change what the doctor said? Well, but if you disagree that something was if not done that day, or something was done that's not in the record, you have the right to do that. Another important one is that helps protect you and helps protect patients' rights is that employers don't have access to patient health info unless they're given authorization. That's pretty important because a lot of places will, especially in the smaller market, meaning a small, what's the word I'm looking for? I apologize. A small employer or just not a very big corporation or something like that. Sometimes they will try to access or ask questions about where patients' health information is, and we are not allowed to or at all give that information out to employers. They could potentially hold it against their employees and get them to lose their job, etc. And patients have the right to decide how and when they want to be contacted. And kind of like Dara spoke about earlier, we have the right to file a complaint, and that's a pretty formal thing that you have to do. It's not necessarily suing, but you can form a complaint and say that this is what happened, this is what went down, and they should, something should happen or they should be investigated. Next slide. A big part of today's world is computers and the technology that we have to deal with and that we use. And so that kind of brings us to the security rule we already talked about a little bit, but a lot of that has to do with the IT compliance. A lot of information is stored and transferred in our computer systems, and the risk to that data is very great in certain situations, especially where you might have a small clinic that doesn't invest a lot of money into protecting that information. The security rule applies to all sizes of clinics. So whether it's that small clinic or whether it's a large organization like a very big hospital or chain of hospital, being compliant really is important. That security rule establishes the standards that protect our electronic health information, and it's whether those things are received or transmitted. It has to be done in a correct way. Now, they don't necessarily go out and say these are the types of firewalls that you have to have. This is the type of encryption that you have to have, but it's very important to have those things set in place. So that, let's see here. Some of the things I have, for example, in my office as far as IT compliance are a little bit more like pretty basic. We've got an in-house server where all the information is kept and it's stored encrypted. Our internet has a firewall on it so that hackers cannot get into it. Those things are all very important to make things safe. Is it possible to play that video? And I hope it's the right one.
Which video where?
No, just kidding. The one that I had set up originally, where that picture is, it was a video. So we're good. We'll just go past it. It was going to talk a little bit about the security role, but that's fine anyways. You can go to the next slide.
Okay, if you want me to try and YouTube it real quick, I could.
No, that's totally fine. It's about a minute long and just kind of talks about the security role. That's okay.
Okay.
I thought this was kind of interesting. Some of the top common HIPAA violations and issues, and a lot of these I've actually seen in the last short while that I've worked there. Not necessarily like that I've done it or that it's happened, or I've just heard about it or seen it. But I know of a person that was fired for simply in a public setting saying hi to a patient and saying that they missed them at their appointment. They were fired because that patient did not want anybody to know that they were at the doctor, and they got the employee fired, and that was kind of tragic for the person. But anyways, medical records mishandling, lost or stolen devices. If there's anything lost or stolen, it needs to be reported. Texting patient information. Physicians actually have ways to text each other. They have a certain messaging tools that make sure that that information is safe and secure. Social media, there's people that are fined consistently or a lot of the times for posting something funny that happened at work, and what they don't know is in the background there's a important information from somebody, a social security number, etc. Employees illegally accessing patient files, social breaches, authorization requirements, meaning somebody's not getting the right authorization to get information, to release the information correctly, accessing patient information on home computers, and just simply lack of training. A lot of times there's just a simple lack of training from in doctor's office keeping your information safe. I think it's important. Physicians and the people that work there, they're not perfect, and that's for sure. And I think in general, they try their best, but there are some clinics that are just have a tough time following those type of things and don't really have rules set in place. So it's important to just make sure to keep your own information safe, and if you feel like it's being mishandled, you can call them out on it and kind of scare them a little bit. By the way, I don't know if anybody knew this, but the penalties, monetary and otherwise, are not just payable by the clinics or the hospitals. They are sometimes on an individual basis as well. So if somebody mishandles information in a certain way, they could, not just the clinic, but the actual person who did it, the employee, could be penalized personally. Last slide, please. So kind of what's next for HIPAA, what's going to be happening, and what's kind of the next step is, let's see here, is just the evolving of the internet, or excuse me, the access to that material. The notice of privacy practices gets revised all the time. That was revised a few years back, and it's going to continue to evolve. Continued rules and regulations for the electronic form of medical info. If we just think 10 years ago on how we used to use electronics and how we use it now, I really believe that in 10 years we're going to be doing some changes as well, just based on where the electronic forms of media is going. And those mostly are likely due to ever changing electronic means, just because of the issues with data storage, transfer, and protection. And that's all I have.
All right. Is that it for everybody then?
Yep.
Great work.
Okay, very good. Looks like you're unmuted, which is great. Let's do a quick question and answer, and I'll let you go. Probably get some sleeps. So HIPAA,
Mhm.
obviously, through I'm sure you know through your reading, it's a big deal. Whether it's a family practice, a hospital, whatever else. In your opinion, why is HIPAA and the laws behind HIPAA such an important factor? Why is it important? Why is it such a big deal? It's for anybody, of course.
Well, I feel like, especially nowadays when there's so much diseases that exist that can prevent people from working, and then having HIPAA there as a them, especially those that have pre-existing conditions like AIDS or any other STD or any, they're covered by HIPAA so that they can still work and still provide for themselves and for their families. So I think that that's super important.
I would add to that that a condition or an illness that you might have doesn't define you, and a lot of times other your place of work, where you work, and those that you involve yourself with. A lot of times people just don't need to know about stuff because they might judge you otherwise, and it's important to know that patients can keep that safe, and not that it would be a danger to the place where you work, but it's just important so that you can keep a job, people don't judge you, and you can move forward with your life without being judged on your illness.
I would add that the move towards electronic standards for passing information and storing information is an important first step for the government to encourage uniformity in an obviously fractured system, and that it's going to lead us in the right direction to have better information for healthcare and as individuals.
I think that's a really good point. I think also as you interact or as you hear things, as we move more towards the EMR, EHR systems that you're referring to, I think there's a very positive feel for it. But then, and I'd also say kind of the older generation has a lot of concerns about that and the security behind that. If this were an instance at the hospital you're working at, what's something you could say to help alleviate some of their concerns about security issues and everything going electronic?
What's one of the ways we can alleviate issues with the actual hospital or with the patients that go there?
With patients who would be concerned about their information being stored online.
Well, I'll tell you what. There's pretty big fines for the clinics and hospitals where their information is stored if it's not stored correctly, and if they were ever
I've had to request some medical results, and I've had to go through like 3 different systems just to get to the one page that has the information that I need on it. But in my experience, it's pretty secure. Email first, and then from that email you go to a site, and then from that site you have to put in like your information to make sure that it's you, and from there it's got like another authorization page, and then finally you get to the inbox where they've stored the encrypted messages. So I don't know, in my experience it works out pretty well.
Those hospitals have plenty of motivation to keep it safe just because of the penalties that come with it if they don't.
I think in general also most less technologically inclined folks are less concerned about the fact that their information's stored on electronically than they are about them having to access it electronically. And since that's not a requirement, they don't have to deal with it. In most cases, that should alleviate any concerns they have. As long as they can get their hard copy, they should be okay.
That's funny because I do also teach a EHR, EMR type class, and we do cover that quite a bit where, the older generation, they don't want to have to worry about scheduling things online or getting their information online. They'd rather just have it in their hands and call in, that type of stuff. Going along also with what you're saying with as far as punishments if for breaking HIPAA violations, whenever I hear presentations on HIPAA, what comes to mind a while ago when I was working at a hospital, actually a member of the Quorum of the 12 was admitted into the hospital, and a number of employees actually lost their jobs because they tapped into this patient's information and looked it up and all this other stuff. Through your research and everything, what were you able to see as the different, I guess, variations of punishment that goes along with violation of the HIPAA policies?
I'm actually looking at it right now. There's different tiers. It looks like, anyways, to me, there's 4 tiers of monetary penalties, and it's all based on kind of how knowing or unknowing the person or clinic or hospital was. There's also potential jail sentences even for people.
Yeah, that's perfect. That's kind of the 2 things I wanted to point out. Was a lot of the punishments that go along with it is based on intent. Basically, were you really meaning to divulge this information that you shouldn't have to the wrong person or whatever else? There can be monetary fines, like you talked about, not just the hospital or clinic or organization being sued, but the individual themselves, or even jail time as well. It can get as extreme as that. So obviously a big deal. You guys all did a great job presenting it. I appreciate the hard work you put into it. Is there anything you want to add before I let you go?
Nope.
I think that's it.
All right. Well, I appreciate it again, and enjoy the rest of your night.
Thanks. Have a good night.
Thank you.
Thanks.
You
Bye-bye.
bet. We'll see you later.